Very good. Good evening. Good evening. My name is Dr. Todd Brandt. I'm a urologist. I'm based in Woodbury, Minnesota. I want to take the opportunity to thank you for joining us for this first ever AMS webinar, a men's health seminar about erectile dysfunction, both treatment and a little discussion of the causes. I want to thank AMS for sponsoring this event. I'm not an AMS employee. I'm based in Woodbury, Minnesota, and I'm a private practice urologist with Metro Urology, a division of Minnesota Urology. Because this is our first ever webinar, there's a couple of things I want to go over prior to going through what we're exactly going to do tonight, which is review a slide presentation, which is a standard slide presentation presented to me and given the slides given to me by AMS. Cover the topic of erectile dysfunction, both what it is and how we treat it. A couple of details here before we get started. This is a webinar. You can see me, but I can't see you. But I do want to hear from you. So there is a button where you can submit questions, and I think that you're seeing that below this screen that you're viewing where I am. And so go ahead and submit your questions at any time during the presentation. We will be reviewing those during the presentation, and if there's a point that needs to be clarified, immediately we will go ahead and do that and answer that question specifically. But we're probably going to be saving most of the questions to a question and answer period at the end. We are hoping to do a presentation that lasts about 30 minutes. So my slide presentation hopefully will last about 20 minutes. We'll see how close I get to that. If I run over, I apologize. Because the slide presentation was not changed, it's vetted both for medical content as well as for medical legal content. We didn't really change the slides for the presentation. So I would encourage you, if you're watching this on a small screen, to go ahead and, if you can, access this on a little larger screen, a laptop or a desktop computer, and you may be able to see some of the slides on the content a little bit easier. I think we can just go ahead and get started. So we'll show the slides and I'll go ahead and give the presentation. Just take a second here to get the slides. As I said, tonight we're going to be talking about understanding erectile dysfunction and really go over some of the main treatment options that we use clinically, with a special emphasis on the end on penile implantation and surgical correction of impotence. This is some of my information. My name at the top, Todd Brandt. I am based in Woodbury, Minnesota, and as I said, I am a partner in the practice of Metro Urology, which is a division of Minnesota Urology. I did my residency at the University of Iowa, and I attended medical school at Vanderbilt University. I have a special interest in prosthetic urology, as well as prostate cancer, other prostate diseases such as enlarged prostate or BPH, kidney stone diseases, and men's health. I really got into prosthetic urology as an offshoot of the prostate cancer treatments we were doing, and we'll talk a little bit about how prostate cancer and the prostate cancer surgeries and other treatments can create erectile dysfunction. And I really got into prosthetic urology as a way to help men who had been through that process, as well as other men who had erectile dysfunction due to other causes, treat and restore sexual function, treating that surgically when other treatments had failed. I'm going to show the summary slide first, just so we know where we're going in this presentation. Basically, there's 5 points that we're going to be covering. We're going to talk about how erectile dysfunction is a common problem, and it's often associated with other medical conditions. We're going to discover that there's a wide variety of treatment options. I shouldn't say a wide variety, but several treatment options that are commonly used. We'll talk about penile implants as a permanent solution for those men where it's appropriate. And we will encourage you to talk with your partner about how best to treat your erectile dysfunction. And then, of course, we want to have you to talk to an ED specialist, especially a prosthetic urologist, if you are thinking about a penile implant. And there's a link to a website here, edcure.org, where you can get access to a local prosthetic urologist in your area. need to ask the question, of course, why are we here? Well, erectile dysfunction for men really affects the quality of life significantly. I mean, I don't have to tell you guys watching that that's the case. It can be extremely frustrating. It can really create problems in relationships, which of course then translates into how you feel about yourself and really how you take care of yourself and other types of general activities. Because it can affect quality of life, and because actually I care about it and I know AMS cares about it, we really want to give this presentation with the main focus on helping you treat the erectile dysfunction that may occur. Let's look a little bit about erectile dysfunction, really what it is, who gets it, and what causes it. Erectile dysfunction is the persistent inability to achieve or maintain an erection firm enough to have sexual intercourse. It is extremely common. So if we take all men who are 20 years or older now, and we look at the incidence of erectile dysfunction over a lifetime, we'll find that a lot of guys will get erectile dysfunction that begins at some point in their lives. Certainly as men get older, 50s, 60s, 70s, and 80s, the incidence of that increases significantly. But as someone who sees this in the office and takes care of men clinically, we can actually see men in their 20s and 30s who have some degree of erectile dysfunction. More than half the men who are over age 40 will have some degree of erectile dysfunction. Now, that may be very mild, and that may not necessarily drive them into our office, but it may be a sign, and we'll look at this, it may be a sign of other medical problems that begin to occur as men reach 40 and above. And this should really drive some men to think about other aspects of their health. If we look at the overall population, we'll see that erectile dysfunction affects almost 40 million or more American men. Let's talk about the erection process itself. Basically, the erection is a blood filling the penis during arousal. So the penis contains spongy tissue that will fill with blood during an arousal state. When a man gets aroused, the nerves to the penis, to the penile arteries, will cause the penile arteries to dilate. Basically, the muscles in the arteries relax and the arteries will dilate, which allows a significant increase in blood flow to the penis. The additional blood fills the spongy tissue within the penis and makes the penis stiff or hard and causes it to enlarge, of course. As the penis enlarges, the veins which are on the outside of that spongy tissue get pinched, and that essentially traps the blood within the penis so that the blood the penis, which enables and increases the rigidity within the penis and allows it to remain erect. After sexual activity, when a man has ejaculated, the process goes in reverse, where the arteries in the penis will constrict, the blood flow decreases, the veins are allowed to open, and the blood is allowed then back into the bloodstream. Men get erectile dysfunction for a number of different causes. The most common things are things that are going to affect the artery's ability to dilate. So anything that causes vascular disease, which includes diabetes, but is also high blood pressure, obesity, high cholesterol levels, can affect the artery's ability to dilate and allow that increase in blood flow to the penis. Other things that can affect erectile dysfunction include prostate cancer and prostate cancer treatment, diabetes, which both affects the arterial flow to the penis, but also nerve dysfunction. And at the bottom of the screen here, you see that heart disease, which is, of course, a form of vascular disease, can also affect erectile dysfunction. If you look in the pie chart, you'll see that medications are also a very common cause of erectile dysfunction. I want to talk about some specific causes and just touch on a few of these briefly, because these are things that we'll commonly see as physicians in the office that we'll have to address as men come in with erectile dysfunction. We'll want to address some of these other issues as well, both as causes as well as ways to help them improve their overall health and potentially reverse some of the damage that's occurred from these diseases and help them restore sexual function. So let's look at erectile dysfunction and heart disease. Erectile dysfunction may be a warning sign of more serious cardiovascular conditions. And in fact, the early onset of erectile dysfunction, so a man who has erectile dysfunction early in life may actually be more prone to having a cardiac event just several years later after the onset of the erectile dysfunction. So a man who comes in who has erectile dysfunction and he's young, who may have untreated high blood pressure, high cholesterol levels, may have gained some weight through the years. We really want to counsel that man that his erectile dysfunction may be an early indicator that he's going to suffer some cardiac event in the future. And that is if we're going to compare the arterial size of the arteries that go to the penis relative to some of the other arteries within the body. In this screen, in this slide, we can see that the penile artery is significantly smaller than the main artery supplying the heart, which is the artery size just to the right of that smallest artery. It's smaller than the main neck artery, which is the internal carotid artery, and it's significantly smaller than the arteries to the legs, which is the last circle on the right. Being so much smaller is affected by anything that causes arterial disease, such as arterial plaques or atherosclerosis, and what that is a plugging of the arteries from fatty deposits due to, again, high blood pressure, obesity, high cholesterol, diabetes. It's going to plug a small artery faster than some of these larger arteries, which is the reason that we often see erectile dysfunction preceding some other events, such as a heart attack or a stroke or poor blood flow to the legs, which would cause claudication or leg pain while walking. It's important when we see a man in the office who has some of these risk factors, who has ED, really to talk about risk reduction, both for cardiovascular health to prevent a heart attack, but also to talk about those risk factors and how they play into erectile dysfunction. So, we're often talking to guys about making dietary changes, making sure they're getting exercise, looking at their weight loss potential. Can they go on a diet? Can they reverse some of their erectile dysfunction and certainly cardiac risk with weight loss? We typically are advising men to quit smoking, and of course, stress reduction, if we can do that, is helpful as well. Move on to diabetes. Diabetes is extremely common, of course, and it's increasing. Type 2 diabetes has been increasing within our population significantly over the last number of years, both with our significant poor American diet, as well as with significant increase in obesity levels within our country. And diabetes really affects and causes significant problems with erectile function. Erectile dysfunction is seen much earlier in men who have diabetes. It is seen much more commonly in men with diabetes. Erectile dysfunction seen in men with diabetes is less responsive to oral treatments such as Viagra, Cialis, Levitra, Stendra, or Staxin. And erectile dysfunction can often be the presenting symptom of diabetes. Factors that increase erectile dysfunction in men with diabetes are the age of onset of diabetes. So if a man gets diabetes much younger, he's much more likely as he ages to get erectile dysfunction. The ability that he has to control his blood sugar, so his level of blood sugar control significantly affects his long-term risk for erectile dysfunction. Whether or not he has other complications of diabetes, such as problems with his eyes or problems with his feet, hands, or nerves, and whether or not he's actually being treated for cardiovascular disease along with his diabetes or getting other medications also significantly increase a man's risk of having erectile dysfunction with the diabetes. I want to touch briefly on prostate cancer, as many of you may have had prostate cancer treatment. And just a single slide here talking about why treatment, whether it's surgery, in this case we have a picture of that, or even radiation, can cause erectile dysfunction. The nerves to the penis run along the back side of the prostate. And during any sort of treatment, such as removal of the prostate or radiation to that area, we can potentially damage those nerves. So when we're talking to a man about prostate cancer surgery, we're often talking about what we call a nerve sparing procedure, which is to peel those nerves to the penis off the backside of the prostate so that as the prostate's removed and we sew the bladder down to the urethral sphincter, in the bottom portion of this slide, you see the preservation of those nerve bundles to the penis, which then allows the nerve signal to dilate the arteries to the penis to remain intact. So hopefully we can restore a man's sexual function after their prostate cancer treatment. If you've had prostate cancer treatment, you know that the initial phases of treatment can significantly impact your ability to get an erection and maintain it, and that can be a problem that is ongoing even as you heal. I want to touch briefly on erectile dysfunction and Peyronie's disease, as that can be have a significant impact on your overall erection quality. And Peyronie's disease is a common disease that is really development of a fibrous scar, or what we call a plaque, inside the penile tissues that normally expand and fill with blood. And what happens with that is it's felt to be an injury to the penile tissue that when the plaque forms, doesn't allow that penis to stretch in the area where the fibrous plaque is, and it pulls the penis to that side and often causes a curvature. So in the picture we see here, we see the penis trying to get erect, but the fibrous plaque is pulling on it, which it forces the penis to curve upwards. So men can present with upward curvature, left-right curvature, or downward curvature. That plaque formation both can cause curvature, which makes it difficult to be sexually active, but it can also cause erectile dysfunction by not allowing the penile tissues to expand and to hold on to the blood as the arteries fill. Again, another indication or another reason that we see erectile dysfunction in men presenting to the office is low testosterone levels. You'll see lots of advertisements about low testosterone and the symptoms of low T. Now, just treating the low testosterone may not actually impact your overall erection quality. In some men it does, but in most men it's not necessarily the primary treatment for the erectile dysfunction, but having low T can significantly affect your overall physical fatigue level, affecting your mental or emotional state as far as your motivation or your what we call libido or your sex drive. So looking into this, getting your testosterone tested, thinking about replacement, and really having a good discussion with your physician about treating your testosterone can really impact both your sexual drive and your desire for sexual activity, as well as potentially the erectile dysfunction. I'm going to move on to erectile dysfunction treatment options and really go through one by one the different treatment options that are available. A lot of guys are asking, who should they actually be seeing for treatment of erectile dysfunction? And there's really a broad range of physicians who can help you with this. My typical recommendation for guys is to start with their primary care physician or their family physician and really address the erectile dysfunction as part of an overall global health assessment. So a man who's having erectile dysfunction, as we talked about, should be thinking about the potential for cardiovascular disease risk as well. And the people who are best, the doctors who are best able to handle that discussion are really your primary care physicians. So if you're on high blood pressure medication, you're being treated for cholesterol, you want to talk about smoking cessation or weight loss, really addressing those issues along with a discussion about erectile dysfunction is best handled at that primary care level. The next physician that you'll want to see, if your primary care physician either is not comfortable with that discussion or is not able to really go over the different treatment options with you, is to talk with a urologist. And most urologists will have good training in the next level of treatments, which we'll talk about, which would include either vacuum erection devices or injection treatments. But they may not necessarily be prosthetic urologists who are specialists in placement of a penile prosthesis or the surgical correction of erectile dysfunction. These are the treatment options. There are medications, and as you know, they have brand names. There's Viagra and Cialis and Stendra, Levitra, Staxin. There are penile injections, implants, there are vacuum erection devices, and there are Muse urethral suppositories. And we're going to go through each one of these individually. Let's talk about medications. Many of you, I suspect, have tried the medications. If you've been watching, you've either tried these medications because you got a sample from your physician, or because you got a prescription and you tried a few of these medications. And for many men, medications will work. This works for approximately about 60 to 80% of all men who have tried this will find the medications are effective, at least for a period of time. What the medications do is they increase the blood flow to the penis by helping the normal nerve signal to the arteries to really help the arteries expand by helping the muscles relax. The medications work and require sexual stimulation. So when you take these medicines, you don't just get an erection watching TV or watching football or something. It really requires sexual stimulation to get the arousal, get the nerve signal to the arteries to help those arteries dilate. Typically, the medications are taken about an hour or two before sexual activity, which can be difficult from a timing perspective with couples when they have to sort of time when they're going to take the medications. And there's a window of opportunity there for the medications within the body to work. So say for Viagra, that window of opportunity is usually about 4 hours. Medications can only be taken about once a day and shouldn't be taken more than a couple times a week. And then some of these medications can really be affected by what you have in your stomach because they may or may not be absorbed well with food. These medications have side effects, which can include headache or facial flushing, stuffy nose, or an upset stomach. There's also some significant precautions you should take, and really shouldn't. I'm going to editorialize here, but some guys will get these medications and I don't know how they get them from friends or neighbors, but they'll try these without a physician's advice. And I think it's extremely important that you talk with a physician before you take any of these medications to make sure that any other medications that you're taking, specifically any medication that has nitrates in it, is discussed with your physician, because these medications can be dangerous when combined with other medications that you may be on. Discussion with your physician prior to taking this is extremely, extremely important. Now, the primary care physicians are usually very comfortable with prescribing and talking about medications. But when it comes to these next few treatments, this is really where you want to see a urologist. So when the medications have failed, and for a certain percentage of guys, these medications will either not work immediately or they will fail over time, we'll move on to a discussion with the urologist about the following treatments. One of the options that we have is for men to use a vacuum erection device, which helps to draw blood into the penis, and through a vacuum, we draw blood into the penis and we place a constrictive band at the base of the penis to hold the blood in. Pumps are bought. Usually at our office, we have those available, and we sell them through a distributor, through a representative of the company that makes that. And that's how I think most people are getting their devices. They can be bought online as well. Patient satisfaction rates with these are actually pretty high. You'd think that they would be uncomfortable, and they can be, and we'll talk about that. But men who choose this option often find that it's relatively convenient. It's been a safe option, and once they get used to the process of drawing the blood into the penis using the vacuum device and putting the constrictive band on, there are some couples and some men who really have good success rates long term. Where men have problems, however, are the significant potential risks of the vacuum device, which includes both just discomfort from wearing that constrictive band, even bruising of the penis, or numbness of the penis or coldness of the penis because of lack of blood flow from the constrictive band. The constrictive band can also block ejaculation, which of course decreases satisfaction during sexual activity. Some men find the vacuum device just difficult in general to work, and they don't ever quite get the hang of it. Next option is urethral suppositories, which is a pellet placed into the urethra, which absorbs and directly dilates the arteries to the penis. Now, I don't actually find that these are consistently effective, and so it's not a first-line treatment that I typically use. However, some men find these to be more desirable than actually doing an injection, which we'll talk about next. These medications potentially have some risk because obviously you have to place the pellet within the penis. There can be a burning or irritation along the urethra, and there can be some systemic side effects as well. What I find effective for some men is actually doing an injection into the penis. That's called intracavernosal injection therapy, or penile self-injections. This is quite simple. Basically, it's injecting a medication into the penis to dilate the arteries directly during sexual activity to allow the blood to fill. Once guys learn how to do this, most patients find this effective, and over time, the medications with the injections may wear off in terms of their ability to actually do the job of dilating the arteries. And some men just can't get over the idea of actually doing an injection. The medications can cause pain. Over time, through repeated injections, you can get fibrosis or scarring. And the biggest risk of the injections is what we call priapism, which is an erection that where the blood stays in the penis too long and it doesn't go away. If those medications or treatments either are not working or men are unsatisfied with those treatment options, then we really talk about moving on to penile implants, which is what I want to focus on next. Now, this is where the prosthetic urologist comes into play. Prosthetic urologist is someone who specializes in penile implants. Penile implants are a surgical correction of erectile dysfunction, meant to be a permanent solution and meant to increase the ability to have both spontaneous sexual function as well as enhancing the ability of the penis to both stay hard for a longer period of time, as well as to be a sort of a readily available wherever you are, whenever the mood is right, sort of a solution. They've been known to have very high patient and partner satisfactions, and I want to address that in the next slide. And the penile implants work almost like your natural physiology, so it typically doesn't interfere with either ejaculation or orgasm. Penile implants have been very safe and been in use for many years, and many implants have been placed. To address the partner satisfaction with the penile implants, there's a very high satisfaction with both patients and their partners when a penile implant is placed. Now, this is really important because talking with your partner, many partners or many couples really have some anxiety about doing a surgical correction for erectile dysfunction. And it's really important as we talk with patients and their partners, both that we have an honest and frank discussion about what their goals are as far as sexual activity, but also to help them understand that the satisfaction rates are extremely high if they've actually chosen this route. Recruiting your partner in this discussion really can help the overall satisfaction at the end of the whole process as well. There are several different types of penile implants. There are single concealable penile implants, which are what we call semi-rigid, and there are inflatable devices, either a two-piece device or a three-piece device. And I really want to go over and spend a little time talking about the three-piece device, which is the most common device that is placed. The three pieces are the cylinders within the penis, a pump within the scrotum, and the reservoir, which gets placed next to the bladder. And the way this works, and I'm going to show you a video on the next slide, is for fluid to be transferred from a reservoir into the cylinders through the pump. I'm going to go ahead and show this video. This is an animation, but basically it will show the position of the cylinders within the penis, the pump within the scrotum, and the reservoir next to the bladder. We'll see the man pump within the scrotum and transfer the fluid from the reservoir, which is up near the bladder, to the cylinders within the penis. After sexual activity, the fluid is transferred back by placing a deflate button. I think I might show that again. That's a short enough video. You'll have to excuse us now. We're having technical difficulties. I've asked for a repeat, but the device itself can be placed, is placed surgically, most often as an outpatient surgery. The way that we do the implant, even though there are three pieces, we will typically place the device through a single incision or sometimes a second incision is needed to place the reservoir. But oftentimes we can get those cylinders within the penis, the pump within the scrotum, and the reservoir next to the bladder through a single incision. So we apologize if you're still hearing my voice. Hopefully the presentation has frozen, but I'm going to continue to talk. Penile implants, as I said, are a surgical procedure, and because of that, there are some possible risks which can occur. The most significant risk that we find is infection. Once we're placing a foreign body into the penis, of infection of about 1% or less, can be up to 2% in some high-risk patients such as diabetics, but there's about a 1% risk of infection for men. And once the device gets infected, the implant itself will need to be removed. The device, the infection is very difficult to get rid of with the device in place. I'm sorry, they still can hear me. Thank you. The other big risks of the surgery can be anesthetic risk, a small risk of bleeding, a small risk of injury to surrounding tissue, the pain issues after surgery, the potential need for a catheter in some men who can't urinate after the procedure, and over the long term, the device can fail. A mechanical failure can occur within the device itself, and causing the need for replacement of the device. So. I think we're back on track now with the slide presentation. Sorry about that. We appreciate your patience during the first ever webinar from AMS. So, as I said, we went through some of the penile implant surgical risks. And again, just want to address the high patient satisfaction and high partner satisfaction. I'm going to kind of finish up the slide presentation at this point and again go through the summary slide. As we heard, erectile dysfunction is a common problem and it's often associated with other conditions, and there are treatment options. A penile implant could be a permanent solution for you, and we would encourage you to talk to your partner and, of course, find a prosthetic urologist in your area if you're interested in the penile implant. Now, I'm also going to do some medical legal housekeeping and go through some of the slides that we need to show that talk about the risks individually of the individual types of implants, as well as go through the references briefly of the presentation itself. The important information for the 3 different types of devices, we would really encourage you to look at this first paragraph, which says that your doctor is the best source of information for the risks and benefits of the different prostheses, and really have that discussion with your physician about your candidacy for an implant if you're considering that. This has been a presentation from AMS Men's Health. I am Dr. Todd Brandt, and we're going to go ahead and turn to some of the questions that we've that have been coming in. So, question number 1: what is the correlation between ED and a large prostate? There is a link. We don't exactly understand why it occurs, but men who have BPH do tend to have a higher incidence of erectile dysfunction. It's treated similarly, and so the same treatment options that exist for men with large prostates also exist, for other causes of erectile dysfunction. One caveat, though, and something I didn't mention, is if you are taking an alpha blocker for treatment of BPH and you get started on medications such as Viagra, you need to make sure that those 2 medications are not going to interact. So we often recommend that you separate the dosing of those 2 medications so that you don't get a significant drop in your blood pressure from a combination of those 2 medications. Another question: I've heard that erectile dysfunction is caused by blood flow. Is this true? And the patient goes on to, this man goes on to describe some significant vascular disease with some procedures that he's had. It is very true, as we talked about in the slide with the different artery sizes, the same thing that causes the vascular disease to the heart or to the neck causing strokes, or to the legs that causes blood flow problems to the legs or arms, also affects the small arteries of the penis. And in fact, because the artery in the penis is so small, the atherosclerotic disease, the plaque that develops within the arteries, can occur earlier in the smaller artery. Yeah, so here's a man who describes, common combination of medications, common combination of problems with diabetes, high blood pressure, and end-stage renal failure, who is describing having troubles getting an erection. Just the classic combination of things that would cause the vascular disease that plugs those arteries, that does not allow those arteries to dilate. Some men are asking about the insurance coverage on a penile prosthesis. Insurances often do cover erectile dysfunction, and when we work very closely with men when those things are scheduled and getting those things covered with a prior authorization process. Most prosthetic urologists will have a good process to work with your insurance company to make sure that your insurance company understands that you've been through some of the more conservative treatment options and have failed, and that the option that exists for you is a penile prosthesis treatment. And the vast majority of times, the insurances will cover the implant once they know that you have tried and failed some of the more conservative treatment options. A man is asking about what's the kind of common malfunction that he asked about what the mechanical failures are for the devices. Typically over time, the mechanical failures can be a leak of fluid in the system. You should know that the fluid that's put in these devices is basically salt water. When you have a leak in the system, the fluid that's inside is extremely safe. It's just salt water and it gets absorbed readily by your body. And asked about how it feels as far as the sensation, both to him and to his partner. And actually the partners tend to feel that it's a normal erection, and they don't feel any different than if you had a normal physiologic erection. And the same is true for you. It works by replacing that normal blood filling within the penis with those cylinders that will inflate and deflate, and so it feels like a normal erection when you're sexually active. One man asked if the penile implants are latex free. I think a man asked about latex allergy, and the AMS implants are all latex free, and so you can feel comfortable with regard to that. One man asked about what we do to try to prevent infections. What we will typically do, and this is what has happened over the last few years, and that one of the advances within the penile implants has actually been an antibiotic coating. And if you remember from the slide, the implant itself actually has an orange coating, which is an antibiotic coating on the device itself to really try to help prevent infections. So when I put an implant in, we're putting patients on an antibiotic both during the operation as well as doing antibiotic irrigation. We have an antibiotic coating on the device, and of course we give them an antibiotic when they go home as well. So we really try to prevent that infection. One man asked, how do I really know if an implant is right for me? How do I know that I'm ready for an implant? And this is a big question I get in the office. A man comes in, he's sort of been struggling with, maybe he struggled with pills for a while, then he tried the vacuum device, he tried the injections, and he's just wondering, should he move on to the implant or not? And I tell guys a couple of things. One is if they have had this discussion with their partner and they're both motivated to continue sexual activity, continue that level of intimacy, and if they're getting frustrated with the other conservative options, it's my belief that that couple moving on to a penile implant will have a high degree of satisfaction in terms of their overall sexual function, that it will really enhance their relationship. There's no one right answer to know how and when to move on to the penile implant, but it's it's really such a personal decision. My basic discussion with the patient is really to encourage them, to tell them about the risks, and then just to let them know that A, it's okay, B, most couples have been very happy, and C, it's our goal to make sure that happens. So we're very conscious of safety, we're very conscious about getting the right device, and just helping them through that process. The last thing, what we've done, and I think we're probably at the end here for closing. One last thing I'm going to mention, typically, when we've done this slide presentation, we do it in a small group format or in a presentation in a lecture hall with the PowerPoint. And we would often bring a patient in who's actually had a penile implant, talk about their process and how they made that decision. What we're going to do, and we've sort of I've worked with AMS to help to try to arrange this, but as a pet project of my own, I have a podcast series that I've been doing, and I'm actually going to interview a patient who's had a implant, and we're going to talk about what his experience has been going through the process of, erectile dysfunction treatments and how he made the decision to have a penile implant. And I'm going to be interviewing him. We're going to have a discussion later this week, and I'll try to post that on my podcast probably this weekend. The podcast can be found on iTunes or other podcast services. It's Why Urology, just Why Urology. The website is whyurologypodcast.com, and I think you can just search in iTunes under my name and it will pop up. And you'll see some old episodes that I've done. I'm not an experienced podcaster by any means, but just an experiment to try to educate patients about different urologic problems. I really appreciate your joining us tonight. We've had a little bit of technical glitch. That's to be expected on the first go around. We really appreciate your patience. I appreciate your questions. And please don't hesitate to reach out to us through edcure.com. Look at the podcast and Why Urology Podcast, and you can always try to contact me at Metro Urology in Woodbury, Minnesota.